friends, how are you? Hope you are doing well. In this emergency drug series, today we will be going to discuss about nitroglycerin or NTG. Me, Titi, wants to welcome you all to my channel Nursing Made Easy with Titi. So we will be discussing today on nitroglycerin. Nitroglycerin mostly used to treat myocardial infarction and angina pectoris, and we'll see how it acts on angina to treat the angina pectoris. So nitroglycerin mode of action. This is our heart. This is right atrium, right ventricle, left atrium, left ventricle. So nitroglycerin medications, it convert to NO, nitrate oxide. So it relaxes the heart muscles, smooth muscles especially. So that's how it helps the cardiac workload. This is the first point. Second point, it works on the vasodilation on the veins. So if the veins dilatation will be there, so blood pressure will be reduced and there will be decreased amount of entering blood in the right atrium, and that's how it will decrease the preload of heart, and again it helps to reduce the workload of the cardiac muscles. Secondly, so first point, it acts as a vasodilation to reduce preload and reduce cardiac overload. Secondly, it helps as a dilates the coronary artery. Coronary artery, which supplies the oxygenated blood to the heart muscles. If dilatation is there, so it will take more oxygenated blood to the heart muscles, and there will be more pumping of oxygen in the heart muscles, and the angina will be reduced in that cases. So overall effect is reduce the myocardial oxygen demand. Second is relief angina. Third is improve the oxygen flow of the cardiac muscles. Okay, this is the mode of action of nitroglycerin or NTG. Let's come the indication. So nitroglycerin is one of the important drug to treat myocardial infarction or heart attack. So we'll be discussing later in some videos. So in that cases, we used to treat as a M for morphine or oxygen and nitroglycerin, and A for aspirin. This is the 4 important drugs to treat myocardial infarction, and so that's how nitroglycerin became one of the important drugs to treat myocardial infarction to reduce chest pain in such cases. Second is to treat angina pectoris. Angina means chest pain. In case of CAD, coronary artery disease, there will be on and off chest pain might be there. So to treat that, how to treat? We have already discussed about the mode of action. It will increase the oxygenation, it will release the cardiac muscles. So that is how it will reduce the chest pain, improve the oxygenation of heart muscles to treat angina pectoris. Third point is angina pectoris. Third is heart failure. So in case of heart failure, as it has a vasodilation effect, it will reduce the preload of heart. So we can use this drug to treat heart failure to reduce the cardiac workload. Fourth point is hypertension crisis. So because of vasodilation effect, the BP will be reduced. So we can also use these drugs as a antihypertensive drugs. And fifth indication is preoperative or postoperative preparation to reduce the ischemia of cardiac muscles. Because oxygenation level will be high in that, to use these drugs for the case of cardiac muscles. So we can use as a post-operative cardiac surgery cases. This is the indication of nitroglycerin. Let's discuss about the doses. So for angina pectoris, we can administer these drugs 0.3 to 0.5 mcg per kg. We can repeat every 5 minutes interval. And how many doses we can give? We can give as a 3 dose. So route will be sublingual under the tongue or NTG spray. Dose is 0.3 to 0.5 mg every 5 minutes interval. We can repeat this dose. Maximum dose we can give 3 dose. After 3 dose, if the chest pain is not reduced, we have to seek for medical emergency. Let us come to the maintenance dose. Maintenance dose will be 2.5 to 6 mg 12 hours, means BD, as prescribed orally. Now this we should give orally. This is to treat the angina pectoris, and for the MI cases we will be using these drugs for MI cases we will be using these drugs as a IV through. It should be IV, and dose should be 5 mcg per minute as per ICU guideline. Okay. So next come to the contraindications. So I hope you can understand that angina pectoris, initial dose is 0.6 to 0.5 mg. Can repeat 5 minutes interval. Maximum dose is for 3 dose. After 3 dose, if it is not recovered, then you have to seek for medical emergency. Route should be sublingual, or you can use the NTG spray. For MI, we have to use these drugs as a IV through IV access for MI cases. Next, come to the contraindication. If patient is hypersensitive to NTG or nitrous oxide, then we can't use these drugs. Second is severe anemia. If patient is severe anemic, because in case of anemia, the oxygen supply will be low if we increase the oxygen demand. So there will be adverse effect in that drugs. So we can't give the patient who are suffered severe anemia. Third is increase intracranial pressure. So those patients who have head injury, chances of increased intracranial pressure is there. We can't use this drug because there is a effect of decrease the blood pressure. So in that cases it will go down. Hypotension. For the same reason we can use these drugs for hypotensive patient and angle glaucoma. For all those cases we can't use these drugs like and lastly, if we administer these drugs, what all the things we have to take in care? Like precaution, we have to monitor the blood pressure, pulse, and we can't mix these drugs with the other drug like antihypertensive drugs, and there will be some other side effect like flushing, fainting, dizziness. So if patient is complaining this kind of things, we have to immediately either titrate the dose or change the dose or stop the medications. Okay, this is all about nitroglycerin NTG. We mostly used to treat MI and angina pectoris. Hope you understand well. Thank you for watching.